Medicare could be confusing. There's parts of it that you might not know. So let's cover those right now. So let's take a quick look at 5.5 things that you may not know about Medicare and what it did and what it did not cover and when you have to sign up for it. Just a couple of tips that may save you money down the road so that you don't fall victim to things that you just didn't know and missed out on. First of all, you do have to make a choice when you get on Medicare. You could choose to do absolutely nothing and just have original Medicare, but I would not recommend doing that. If you do that, you're exposed to all of the Part A costs, over $1,300 per period that you go into the hospital, and then other costs as well for blood and all these minor things. But the most important thing is the Part B cost. Almost everything today is done outpatient. And when you do that, we're talking about CAT scans, MRIs, x-rays, blood tests, chemo treatment. All the things that are done outpatient when you're not admitted to the hospital are under Part B. And with original Medicare, you're going to pay 20% with no limit. So what do you do about that? Well, one of the choices is you can join a Medicare Supplement Plan. We'll talk about the enrollment periods here in a minute, but a Medicare Supplement is geared toward filling in those gaps. All your Part A costs are going to be covered. Your Part B costs are going to be covered with no limit on how much it's going to pay for you. Yes, you may have a plan that has the exposure on your part to the Part B deductible. It's no big deal. You may have Plan N Medicare Supplement, which has a small copayment as well, but that's not a big deal. When you're looking at potential outpatient costs and the hundreds of thousands of dollars for major illnesses that people go through, having a Medicare supplement in place on top of original Medicare is paramount. On the drug plan, we'll talk about the enrollment periods for drug plans, et cetera, in just a minute. But on the drug plan, you don't want to go without one because of the potential likelihood that you'll be exposed to a lot of drugs for any condition that may come later. This is a big consideration for someone turning 65, considering what their Medicare options are going to be, and they say, you know, I only take one blood pressure medicine. Why do I need a drug plan? You don't need it for today. You need it for the future. And as we'll cover in just a minute, stay tuned, if you don't get it when you can get it, the penalty for getting it later, it accumulates, it multiplies, and it lasts for a lifetime. Stick around. The other alternative to original Medicare and a Medicare supplement, where you can maintain the freedom and the flexibility to go to any provider anywhere for anything that's medically necessary, is a Medicare Advantage plan, also called Part C of Medicare. It's not really a part of Medicare. It's an alternative replacement to Medicare in the private sector. It replaces original Medicare. You can't just walk into your doctor's office if you're on a Medicare Advantage plan. That's a private HMO, PPO, MSA, PFFS plan, a private Medicare Advantage plan, and show your original Medicare card, because it no longer has value for you if you were in the once per year. Let me clarify that. If you are in the annual contract, that is a Medicare Advantage plan, and it is a 1-year contract. At the end of the calendar year, that Medicare Advantage plan will change for the next year. Something will change. It's not the same benefits that you sign up for at the beginning every year in the future. So let's take a little deeper look here. If you delay, this is the biggest thing about when you're turning 65 or you're considering coming off of an employer plan, considering, do I want a Medicare plan or not? When you turn 65, in order to sign up for original Medicare, you have a window of 3 months before your birth month to sign up. It doesn't start then. Then you have your birth month that you could sign up in. Then you have 3 months after that you could sign up still for original Medicare. I don't recommend doing that, and I'll show you here why. But according to Medicare, that's a 7-month window that you can start Medicare Part B. Part A is automatic. If you've worked more than 10 years, that's 40 quarters, Social Security keeps track of that, they will start your Part A automatically. Part B is only automatic if you are currently drawing Social Security income. They will assume that you want Part B, will start deducting Part B from your Social Security income check, and just send you your Medicare card. If, as we talk about in just a minute, you have chosen otherwise, maybe you want to stay on a large group employer plan because the benefits are better than Medicare would be, you need to send that card back and say, no, thank you, I don't want Part B. If, however, you've not chosen to start on Social Security income payments yet, you've deferred until your full retirement age, 66, 67, and that's going to be growing, you're doing yourself a really smart favor, first of all, because of getting an extra at least 8% on your Social Security every year for deferring. But you'll have to go down and manually sign up for Part B. You can do that online, very easy. You can do that by a phone number of calling them, or you can go down to your Social Security office and sit in front of them, take a number, and be treated like you're at the DMV. My preference, of course, would be doing it online. It's very, very simple to do that. So Part B only starts automatically if you're getting Social Security income already. If not, you need to go online and start it. And again, the window to do that is 3 months before your birth month. That's my recommendation. Do it before your birth month. Now, the penalty for not signing up for Part B during this window is 10% per year that you didn't sign up, and it never goes away. And that accumulates. 3 years, 30% of what it would have been otherwise. And then you have to wait for that time of the year that you could sign up for it. You can't just get it just because later you decide that I want to get Part B now. No, you have to wait for a special period that you could get it. So typically, if you do things right on that timeline that I just went through, you sign up for it preferably 3 months prior to your birth month, then your coverage for Medicare Part A and Part B should start on the first of the month of your birth month. Even if your birthday is on the 15th, the 20th, the 25th, 28th, whatever, the first of that month prior to your birthday happening, the month that your birthday is going to happen, the first of that month is when your Medicare Part A and Part B should start. Here's a little known factoid, that if you wait until the month that you turn 65, you wait for that month. This is why I recommend doing it before you turn 65, 3 months before. If you wait till the month you are 65, then you have to wait for another month after, then it starts. No penalty, but you just have to wait. If you wait 1 month after your birth month, you have to wait another 2 months for it to start. Why would you want to do that? This is a benefit you've been earning your entire life. If you wait 3 months after, you have to wait 3 more months for it to become effective. Now, this may vary, and this is often waived. So if you have waited too long and it's your birth month already, or a month after, or 2 months after, I would run, not walk, if your health allows it, down to the Social Security office, get an appointment right away, get in front of them and beg for forgiveness and beg for them to make it happen on the first of the very next month if you can. See if there's some kind of a loophole, some kind of a mercy, some kind of grace that they can give you to get that started as soon as possible. Very often we'll have people that want help with a Medicare plan. Our hands are tied because they do not have their Part B effective date written in stone yet. And if they've waited too long, that date could vary. So we have to wait to submit an application to supplement Original Medicare until they have that date firmly locked in. So we can't help someone until they do have that firmly locked in. And a little caveat here, if your birthday literally happens on the first day of the month, your coverage is going to start fully a month prior. So if your birthday is January 1, then December 31st is when your Medicare Part A and Part B can start. Here's the second big thing. If you delay your Part D drug plan enrollment, same time frame there. Your late penalty on the Part D plan, we'll go over that in just a minute, but you need to have continuous coverage elsewhere, or else you're going to have this penalty. So if you're staying on an employer plan, a large group employer plan, for instance, that has a prescription drug benefit, that's called creditable coverage, and you're not going to be exposed to this penalty. I am not trying to tell you of a fear factor to get you all amped up. Oh, I've got to do something now as a sales tactic. Far too many people in the industry already do that. I'm telling you, if you've got good coverage, you don't need any of this stuff. And we'll go over that in just a minute. What I am telling you is if you wait too long to sign up for a Part D drug plan, or Part B for that matter, you're going to have a lifetime penalty that we can't do anything about. And this one, the Part D penalty, continues to go up every year, even after you've done the right thing to get on a Part D drug plan. Again, this is why I always say if somebody's turning 65 and they're only taking 1 or 2 drugs, at least get a placeholder plan. That is the cheapest Part D drug plan in the market to avoid the future penalties for the time in which you suddenly have a condition, God forbid a serious one like cancer, where they're trying to shift more and more of the cost off of Medicare and onto Part D, onto the drugs that you go take over the counter by buying it with a prescription. That cost, if you don't have a plan in place, is going to be horrendous for you. So get a Part D plan is my recommendation. If you don't get a Part D plan in the time frame that you're supposed to, initially when you're ready for Medicare, either due to turning 65 or leaving your employer plan, it all depends on how long you've gone without it. And this is not broken down by year like Part B penalty is. This is broken down per month. So it's 1% of the national base beneficiary premium, which is going to be $32.74 for 2020. Every year that goes up. And it's multiplied times how many months you did not have coverage that you should have had coverage. So month number 4, 5, 6, 7, after you turn 65 and you did not sign up for Part B, you didn't sign up for Part D, these costs are going to rack up until, and every year, here's the problem. Every year this goes up. It goes up every year because the national base premium goes up. And that's the calculation upon which you multiply the number of months times that national base premium. So get a Part D plan. That's my recommendation. Here's another big one that people just don't know about very often. That is, if you delay in your choices when you're first eligible for Medicare, it takes away your options for the future, especially people who have health challenges. Those people need to be on the ball. Really, if you're working with your mom or your dad and they're coming up to Medicare age and they've had any kind of ailments or sickness or chronic disease that they're managing, you really have to be on the ball to make sure this gets done right. That's why I recommend dealing with a trusted advisor that can walk you through all the steps and make sure that the entire checklist is checked off. Every box is checked. All the things that you need are fully in place. So you cannot always in the future get a Medicare supplement if you did not get one during your initial election period. That is the time that we talked about. 3 months before, the month of, 3 months after. If during that period of time, and actually with Medicare supplements, it's a little bit extended past that. It actually goes 6 months past your Part B, whenever that is, based on turning 65 or based on losing an employer coverage. Whenever you activate Part B, you've got 6 more months of an open enrollment period for Medigap, for Medicare supplement. Now, this is a very unique time frame because this 6 months past Part B does not correlate with anything else out there, not your Part D plan, nothing. So it's just specific for Medicare supplement. It's a time frame in which you better take it seriously, because once you give up that time frame, that time runs out. You may never be able to get on a Medicare supplement again, because after that time frame, except for special circumstances, you have to qualify based on good health. And unfortunately, people want the best insurance when they have the worst possible health. And it's kind of like wanting to get the best homeowner's insurance when your house is on fire. Nobody's going to write that. They want to write a good risk when you're getting started. Well, they don't have a choice when you're in your initial election period. There's no pre-existing condition exclusions. They got to take you, and you can pick any plan available in the market to include, but not limited to, a Medicare supplement, the best one that's out there. But again, if you let that go by, you have very limited options then as to what you can get later in the Medicare supplement space. Now, Medicare Advantage plans, you can sign up for those anytime you want to. Any year that you want to during the annual enrollment period, you can say, hey, you know what? I want to sign up for one of those private plans. They'll take you any year that you want to. Medicare supplement is harder to get on later because, in my personal opinion, that's why it's better, because you have freedom, flexibility, go anywhere, get anything treated without pre-authorizations, without referrals needed. That's why it's harder to get. Oftentimes in life, the things that are harder to achieve, that are harder to get, that there's more barriers to get to, they're better. So obviously, Medicare supplement is worth pursuing if you can, if it matches your budget, and if you're in the market for it. Another thing people don't realize is that Medicare, as good as it is, as comprehensive as it is, does not cover routine dental, vision, or hearing, like hearing aids. Now, dental is covered in very unique situations, like you had an accident. Somebody hit you in the face with a baseball bat accidentally, and you have to go to the hospital. That would be emergency dental, and that would be covered on original Medicare. Regular dental things like cleanings, extractions, fillings, all those kind of things, they're not covered by original Medicare, not at all. Now, people continue to try to want to get those things involved in Medicare and put into Medicare, but the Medicare Trust Fund is already running low every single year they're talking about, and they keep getting that year closer and closer to when the Medicare Trust Fund is going to be exhausted, absent some kind of step in from Congress and additional funding. So they're not going to be adding additional benefits to Medicare, like hearing aids, like dental, like vision coverage for glasses and things like that. It's just not going to happen. The money's not there. Glasses, routinely getting an optician to give you pair of glasses, optometrist, is not going to be covered except for certain conditions. Like if you have glaucoma surgery, if you have macular degeneration treatment, or you have cataracts removed, that will trigger the ability to get a pair of glasses. A Medicare approved pair of glasses is probably not going to be the Ray-Ban best ones you can possibly have. So treatment of disease is covered because that's the health of the eye. Refraction of the lenses where you can get contacts and glasses and that kind of thing are not going to be covered by regular Medicare. Now, a lot of the Medicare supplement companies that we do business with have ancillary benefits included with them that include discounts for certain types of things, including an eye exam and discount on glasses. It may be 10%, 20% discount on glasses. That may be part of your Medicare supplement plan, but original Medicare does not have that. We do have dental, vision, hearing plans that our clients rave about because you can go on one of the plans that we have. You can go to any dentist, you can go to any hearing aid provider, you can go to any vision provider, and you've got up to $1,500 in benefits that you can use there. It's a great program. On the dental side on that program, they also have a network of dentists you can choose to go in and save a lot more money. So if your dentist happens to be in that network, great, you'll save a fortune, plus you'll have cash toward paying that bill. If your dentist is not in that network, you can still have cash toward paying that bill. Anyway, those options are available. You can reach out to us if you don't have one. There is no long-term care coverage in original Medicare. People are like, what? No, Medicare does not have long-term care coverage in there. There's a small carve-out caveat, that's a new word, that you have to be in the hospital for more than a few days, and then you have to have rehab as part of that hospital admission first before it's covered. This has been a big debate in Congress for many years as hospitals have routinely wanted to put you in there under observation status and not fully admitted to the hospital. That does you no good if you're then going to go from the hospital into rehab because you have to be there the set minimum number of nights as fully admitted to the hospital. Also think of it this way. Part A of Medicare covers everything when you're hospitalized, in the hospital, admitted to the hospital. That's the catch. Part B of Medicare covers everything right up to, but not including, admission to the hospital. So if you go to the hospital by ambulance, you go in the emergency room, they check you out, and they say, you know, there's something wrong with your heart. We're going to do some levels. We're going to do some tests on you. We're going to keep you in here for a couple of days. If they never admit you to the hospital and they end up sending you home saying it was ulcers or it was just angina or whatever it was not a full myocardial infarction, not a real heart attack, all that bill is going to be billed under Part B of Medicare. Back to the original slide, if you don't have a Medicare supplement plan to take care of that for you, that entire hospital bill, all the tests, all the blood work, all the doctors, everything that are billed separately, is going to come to you with a 20% big bill saying pay it and pay it now with no limit on it. That's why you need to have something to supplement original Medicare. It does not become a Part A claim of Medicare unless and until you were admitted to the hospital. Then, taken care of, no problem. Everything that's going to happen in the hospital is covered then under Part A. And again, that's assuming that you didn't sign up for a Medicare Advantage plan, the private alternative to original Medicare. On those plans, typically they have a per day admission charge to the hospital. I've seen them as high as $750 per day in the hospital, up to 7 days. So you have to look carefully if you have one of those plans that's a copay type plan, a private insurance plan replacement for original Medicare, because each one of those plans is separate. And if it's a routine hospitalization for you're going to have a hip replacement, knee surgery and all that, on the private Medicare Advantage plans, you must have pre-authorization. You have to go through a bunch of different hoops, starting with your primary care doctor if it's an HMO, getting a referral to an orthopedic, maybe getting a second opinion, trying some alternative cheaper therapies first, trying rehab first, trying this, and then finally you can get into the hospital. At least that's been my experience with our clients. So original Medicare, no, your doctor says you need a hip replacement. Guess what? You're scheduled for a hip replacement. You can go to pretty much any hospital in America, not limited to a network, but I digress. Long-term care is not covered. Routine long-term care saying you're getting older, you're falling down, you need some help, you need to go into a nursing home. That's not covered by Medicare. It may be covered by Medicaid. That's the low-income alternative typically run by the states and subsidized by the federal government. Medicaid is completely different. It's based solely on income. So you would have to spend down all of your assets in order to qualify for Medicaid in order to have long-term care then covered by Medicaid, by the government. but there are alternatives available, and now there are some very creative alternatives available where you don't necessarily have to pay a monthly premium like you did in the past for long-term care insurance. Now there are new options available that can be based on a life insurance chassis, a product, or an annuity product that holds your money for you, gives you additional benefits, and if the case arises where you need long-term care, turns your initial pool of money into much more money for the purpose of paying for long-term care over time. Very creative products that we have access to. Be happy to show those to you if you're interested in doing that. So 5.5, the marketplace. Let's say you've been on Obamacare or whatever, an individual health plan up to the time that you're turning 65. Sometimes people will say, you know what, I like this plan for whatever reason. I'm paying a lot for it. I'm just going to keep this plan. You can't do that. Just keeping your marketplace plan can result in penalties. And if you had the subsidy making your premium lower based on your income on Obamacare, then they find out that you continued on that plan, the insurance company is going to come back to you and say, wait a minute, we've been getting this subsidy. We thought we were going to get this subsidy for you, but you don't qualify for it anymore. You're eligible for Medicare. So why are you getting this subsidy? And then you might have a penalty with the government for taking that subsidy money and supporting your premiums past the age of 65. You need to get off that plan and get the Medicare that you deserve because you earned it. Also, you would have a late enrollment penalty if you did not act during the initial election period we talked about in the first part of this video. You could have then a penalty for life on Part B, a penalty for life on Part D, depending on how many months you went without it. Here's the other caveat. If you're on a small group employer plan and you're turning 65, you're continuing to work. You're going to work long past 65. That's great. But a small group plan that's 19 employees or less, you need to have original Medicare. You need to sign up for Part B of Medicare. You need to make sure you're signed up for Part A of Medicare for the first of your birth month. Because if not, you could be subjected to 80% of the cost of your health care. Why? Because on a small group plan, Medicare is supposed to be primary. If you didn't have Medicare as primary, your small group insurance plan has every right to say, that's not going to be covered. We're only going to cover 20%. Why? Because you should have had Medicare for the 80%. So on a small group plan, you'd better get signed up for Part A and Part B. Now, Part D is questionable. If you've got creditable coverage and you don't need a Part D drug plan, that's fine. Whenever you leave the employer plan, that's going to be a trigger for you to go get your own Part D, and there won't be a penalty. Now, let's look at large group, 20 employees or more in the group. Medicare is going to be secondary, so Medicare is going to be optional for you. Most people expect and would get Part A anyway, but signing up for Part B is completely optional. Things we want to look at for a person that's on a large group and considering whether or not they should get on Medicare: how much is your deductible on your private, your employer health plan? How much is your deductible? What are your limitations on where you can go? Can you have access to all the specialists that you want? Or like in the case of our group plan, you have a very limited network of doctors, only covers your small region. You can't go out of state. You can't go everywhere you want to go. A very limited network of specialists, and trust me, we got the best plan we could get, but this is an Obamacare thing we've inherited. So you may want to look at that. What is the depth of the benefit that you have with your employer plan? How much are you paying for that plan? If you could pay less and have Medicare Part B and a supplement and go anywhere for anything with no major cost, no major deductible, that may be a choice. And the last but not least, very important factor is, what is the drug coverage like at your employer plan? Because commercial drug coverage for pharmaceuticals, is completely different than Medicare coverage under Part D of Medicare. So we don't want to make the mistake of not looking at the whole picture when we're making a recommendation and not take into consideration what a Part D drug plan would cost you total out of pocket. You cannot assume that since you pay $10 a month for a 𝗃𝗏 through your private plan, that it's going to be $10 a month for that same drug on a Part D drug plan. They're not related whatsoever, even at the same pharmacy. So before you make a determination on just the employer plan versus Medicare and a supplement, please, if you take any drugs at all, look at the Part D drug plan impact on you and see if that's going to be even more of a factor. We could save, and we have saved people thousands of dollars a year by taking advantage of the Medicare that they are entitled to and getting a supplement. But then if we had not looked at the drug plan component of that, we could negate all of those savings, because sometimes people take literally thousands of dollars a year in drugs with their costs on a Part D drug plan. You've got to factor in the drugs. It's not a one-for-one, one-size-fits-all. Speaking of one-size-fits-all, if you leave your employer plan, large group, you leave your employer plan insurance, you can still work there. You could just opt out because your special election period of being on 65 years old, that gives you an opportunity to opt out of the employer plan. If you leave that plan and you join a Medicare Advantage plan, everything that I said is still applicable. You need to look at the network, look at the restrictions, look at the pre-authorization requirements, look at the limitations on going to specialists, look at the depth and the breadth of their network. And then if you wanted to go out of their network, how does that affect you? And last but not least, again, the Part D that's incorporated into what they call MAPD, that's Medicare Advantage and Part D put together in one. They call it complete plan, right? The MAPD plan has a drug plan component to it that is not typically customized for your list of drugs. This could impact you greatly, again, if you're considering leaving an employer plan and going on one of those free or low-cost Medicare HMO, Medicare Advantage private plans, because the drug plan cannot be customized just for you. It's a package deal. You take one, you take all. So anyway, consider that. Those are a lot of things to consider, but we could help you with this whole process. There's a bird chirping right outside my window on the 3rd floor. That's kind of weird. So you have to consider Medicare Supplement or Medicare Advantage. The other things that we do in here to help people as they're making their choices going forward is the potential for cancer insurance. Does it make sense? Do you have a family history of cancer? Have you had cancer at some time in your life before that you're concerned about? The out-of-pocket cost notwithstanding, there are other things that a lump sum of $20,000 could help toward, like outpatient things, chemotherapy, driving to appointments, having somebody else drive you to appointments, having some other family member come and spend 1 or 2 or 3 months with you going through that. It's just an extra layer of protection, to say nothing of the fact that your Part D exposure will be potentially much greater if you have cancer and they're trying to push these more to oral medications. So that's available. We have those. And then long-term care insurance, we do that as well. If you want us to meet with you over the phone so we don't have to wipe off our feet to come into your house, we're more than happy to do that and go over these options with you. Being licensed in all the states that we do business in, we know what's available in your state. We can tell immediately what all the plans are, what all the options are, and break it down to something that's simple, specific to you. Here today, I talked about a variety of different scenarios that affect a whole different range of people. Individual plans, you're working, you're not working, you're turning 65, you're on Medicaid, all these different options. In order to look at your specific situation, we just need to talk to you on the phone for 5 minutes. Find out where you are, what research you've done up to this point, and not treat you like some people do, where they're like, let me explain to you the parts of Medicare. No, if you've done your research, you're watching this video, you're an intelligent, educated consumer already, and we can skip through the formalities and just find out where are you at in your process. Let's save the time and help you make a recommendation, a choice to the best possible plan to treat you based on your goals, based on your health, based on where you want to be and what access to care you want to have during your senior life. And we're here to help you. That's all. I want to provide value in these videos so you can take some education from it and make an informed choice. But if you want that specific individualized help just for you, please call me or my team. We're here to help you. You should subscribe to this channel because things are coming up that are going to change in Medicare. Medicare changes just about every year. And as those changes happen, for free, you can keep educated on that. If you're going to be a consumer in the Medicare marketplace, you strongly are suggested to subscribe. So please do that. Please leave a comment below if this has been helpful in any way. Any confusion or the part of Medicare that you have the most frustration with, I'd love to hear about it. Please comment below. I answer just about every comment that I can get to, and I would love to see feedback on this and the other videos. It would really help me a lot. My name is Christopher Westphal. I'm a licensed insurance agent. If I can help you or my team, please call me at the number listed here. We'd be honored to help you in your journey to make it simple and make it easy and painless. And it doesn't cost anything for our service. Thanks for watching, y'all. God bless you. Take care, bye-bye.